Dear friends, I am Dr. Bose. I am a senior consultant pulmonologist practicing in southern part of New Delhi. I am the founder of SANS Foundation. I work for Corporate Hospital National Heart and Fortis, and our forum, Clinics in Chest Medicine India, and a collaborative initiative with Force India Pharmaceutical is playing a pivotal role in educating second level pulmonologists in India, and not only at the level of education and dissemination of knowledge. CICM has also pledged to help your patients, your near and dear ones, to help them to get the right diagnosis. This is what we call the second opinion pulmonology. In our website, you can go to the link and you can ask for the second opinion pulmonology, because many times what happens, the patients, your patients, or your near and dear ones, or even the patients who are observing this podcast, they can directly access to the video. And we have made a very simple rule. You can through a WhatsApp, you can upload your images. Basically what we need, your old reports. If you can share your CT or X-ray images in the video format, that will be nice. If you have got any other ancillary supports like a pulmonary function test or a blood gas ABG report, that will be useful. And also if you have a little summary of previous prescription, all it's possible, you can scan and send them. But the most important thing is the images. There should be clarity in images. And suppose you want to send your images from home, so best thing you can do is that have a background of tube light and get a little image and take a pic and send us. Or if you have an image or a recent CT scan images, you can ask your image person to make it a little video format and share with us. So there are digital, there are a lot of ways. Or whenever you go for this kind of imaging, always try to get it in a digital format. That will be, you can always share it. I'm sure most of the imaging centers, they give you a digital format. So once you upload your images, you can send an audio or text me, we can get back to you. There are numbers mentioned in the website page where you can refer to that numbers, send your images and request for Dr. Bose and his team support. You know how we are different. That is what we are here. The most important thing in the second opinion, which is a differentiator in our CICM initiative, is that first and foremost thing is we try to educate you. Like for example, if somebody is suffering from some COVID related lung diseases or say smoking related lung diseases, we'll give you an image, and which will be very self-explanatory, because image will have an audio support, so that once our doctors under the leadership of Dr. Bose or Dr. Bose himself takes you for the consultation, so he will share you an image and with an audio explanation of the disease, followed by certain specific things which probably not been mentioned in your prescriptions. And the most important thing which is given an emphasis here is that what are the non-molecule or the beyond molecule measures, like what are the techniques you have to follow. Like for example, in the case of post-COVID scenario, now a lot of people, those who have got lung fibrosis or damage of the lungs, they are clueless what is to be done. Now in the post-COVID fibrosis, we'll give you one image, like we can send you a sample of how it has been done. In one of the podcasts will show how we do it. You can refer to that podcast, that how we do this second opinion as a kind of mock drill. But normally what we'll do is that, like for example, suppose you approach us as a second opinion in post-COVID lung fibrosis. So there we'll talk about what is COVID, what are the markers in COVID, and in post-COVID fibrosis, what are the things to be done, and there we'll give you a detailed explanation of pulmonary rehabilitation program, taking you from breathing exercise and nutritional, different high endurance exercise, balancing techniques, sleep rehabilitation, certain monitoring, non-invasive ventilation, drugs and other supports, and also how you can manage your certain issues, even the home care program. So everything is done in a very systematic manner. So one sample we can show you in our one of the podcasts you can refer to. I will show you a sample how we do the second opinion. We will showcase you. Our one podcast will be on the patient education and dissemination of knowledge and second opinion, which we will share you in our next video. So second opinion pulmonology will help you in many ways. First of all, you will be connected with our team of people through your digital networks. Secondly, there will be a lot of patient-centric, patient educating experiences. Thirdly, there will be a total structure approach, what you call a multitasking, multidisciplinary rehabilitation approach also will be discussed. And the most important thing, in very simple language, you'll be told what exactly the problem is and what are the other support services you need. And wherever you are, whichever the part of the country you are or outside country, you can always, it's done in a very simple way. So please refer to our next podcast, how we do it. We'll do a little mock drill for you. Thank you. Regards, Dr. Bose.